To this now, acting ANC spokesperson Zugu Kotlimbi has assured the public that Deputy President Paul Mashatile is in good health. He collapsed yesterday while delivering an address at celebrations in Tzaneen. The presidency saying Mashatile is resting at home.
The Deputy President of the ANC had the unfortunate incident of collapsing when he was giving that address. And the medical doctor said it was due to dehydration. And you might know, President and Deputy President, they are always moving up and down, hardly sleeping. And Limpopo, Tzaneen, the heat does not play games. But the Deputy President is okay. The medical team says they are confident that he's... But of course, we're also getting information from government to update us on how he's doing. But as far as today is concerned and as yesterday, the Deputy President is okay.
Well, let's continue the conversation now and speak to the Deputy President's acting spokesperson, Khoza, who is one of the officials that were there yesterday when this incident occurred. Mr. Khoza, good evening to you and thank you for your time. Let's start with the health status of the Deputy President. When last did you see him and how would you describe his health?
Good evening, Claudia. The President's state of health is good, despite what happened yesterday. It would have caused a concern at a point when he was falling and had to be helped out of the address area to get medical attention. We were, however, relieved that even when at a point where he was falling off the stage, he was fully conscious. And when we spoke to him, he said, no, he had lost balance because he became lightheaded. And, well, the doctors said, if you become lightheaded, what follows is that you lose balance. And that's why he couldn't continue addressing the people he was addressing.
Were you aware, as his staff in the office, ahead of the trip to Limpopo, that he was unwell? And I'm saying he was unwell because on Friday, while addressing students, he did say, quote unquote, that he felt as though he had had food poisoning.
Well, there was that concern on Friday, and I remember on Saturday morning, I called to check if is he able to go to Limpopo for the commitments, and he said he was fine, was feeling better than he had felt the day before. So we're relieved that he could be able to honor the commitment, owing to the fact that he was feeling better.
So I guess the response to that question is that the element of food poisoning is acknowledged. It is something that he did say. However, the question that follows then is, if indeed he did collapse owing to dehydration as a result of the heat, which of these two should we believe, that there is food poisoning on one hand and there is dehydration because of the hot weather?
Well, if there was food poisoning, as he suspected there was, it does cause dehydration, because what food poisoning, how it manifests, is that it messes with your system, your bowel system, and that dehydrates you. So being exposed to the sun as well for a long period. Remember, when you go to the place, he also taught some areas when to plant trees under the sun.
Yeah.
Before we went to where he was going to address the tribe. So he was exposed to the heat for some time before he ascended to the stage.
The scramble to try and get him into a vehicle, that seemed very chaotic. It's obviously because people are circulating that kind of material on social media. It seemed chaotic and very poorly executed. Could that have been handled better, you think?
No, I don't. I disagree with you. What happened is that when that happened, remember the brief of the police. If anything happens to the deputy president, you evacuate him, take him to his car, and leave the area, and attend to whatever situation that comes up after that. And that's exactly what they did. As he was falling, they rushed to hold him, carried him out of the area to the car with the medical personnel, and they left the area. So there is no other way you could have done it, because in terms of the status of the deputy president, cannot receive medical attention in a public area where everybody is looking. You have to take him to a place that is secure, where you can guarantee the safety of the deputy president.
So everything that was supposed to be, or that was supposed to have been there, was there.
Was there.
That's
the
what
medical team was there. They went with him in his car as they were leaving the area. So he was immediately under medical supervision when they left the area, the village, the cultural village.
You mentioned earlier that after the food poisoning that he had mentioned, the Friday before he leaves for Limpopo, you said you gave him a call to find out, is it good to go?
Yes.
And he gave it the thumbs up.
Yeah,
but,
remember...
But as advisors, can I just complete this question? As advisors, because that's actually your role. You are a special advisor to the deputy president. Do you advise at times that they take a break? I mean, the president just the other day had an eye infection, but he still was committed. It was only at the last minute that he had to pull out because it just wasn't getting better. Are these officials advised to take a break?
Well, they are often advised to. At times they do take, but at times they look at the commitment at hand to see if can we sacrifice this commitment, or can we do this and come back and rest rather than relaxing to rest. So it depends how they feel physically at that moment, whether they can carry themselves to be able to do what's supposed to be done and retreat to resting at a later stage.
Final question, Mr. Khoza. Conspiracies and information peddling is something that is not new in politics. Sometimes it is taken seriously. What would the response be to those who will try to make political capital out of the deputy president's health scare?
Well, you can rest assured that conspiracy theorists will always be there. In any political situation, there will always be a diversion by people who give their own interpretation of what happened yesterday. For instance, yesterday they spoke about the DP having been airlifted when there was no chopper. They spoke about him having gone to a hospital. He was not in a hospital. He didn't go to the hospital. There was no need for him to go to the hospital. And they were saying all sorts of things. And we kept on saying that the DP is fine because we had spoken to him, he was laughing, and was... After that incident, he even sat down to eat before leaving Limpopo.
So all in all, the deputy president is in the clear and there is no political intrigue here?
There isn't. Even the medical personnel, with that situation having happened yesterday, they are bound to monitor the situation. They're not picking up anything that's untoward.